Welcome to this explainer. Okay, today we are tackling something that literally almost everyone deals with at some point. We're demystifying muscle adhesions. We're going to cover exactly what causes them, how to spot the symptoms, and most importantly, how to actually get some relief. If you've ever felt like your own body is just fighting back against your best efforts to loosen up a stubborn knot, well, you are definitely in the right place. Let's dive right in.
So why won't stretching fix that stubborn muscle knot? Man, it is incredibly frustrating, isn't it? You've got that one spot. Maybe it's right in your neck, or tucked between your shoulder blades, or maybe it's down in your calves. You stretch it, you try to stretch it some more, you contort yourself into all sorts of weird angles, but the knot simply refuses to go away. I mean, sure, it might feel a little better for, 10 minutes? But then it's right back. Why doesn't stretching fix it? Well, because, as our sources reveal, you aren't actually dealing with a simple tight muscle here. You're dealing with something fundamentally different at a structural level.
Clinicians note that patients frequently describe this exact sensation as a persistent tightrope. It's not just a general ache. It feels like this rigid, unyielding cord under your skin that simply does not give way, no matter how much you pull or stretch it. If that tightrope feeling resonates with your own physical experience, well, we've officially identified our main suspect. We are talking about muscle adhesions.
So let's clearly define what's actually happening microscopically just under your skin. A muscle adhesion occurs when the layers of muscle and your fascia, which, by the way, is the connective tissue wrapping around all your muscles, literally become stuck together. Normally, these tissues are supposed to just slide and glide beautifully past one another as you move, but an adhesion creates these thick, sticky bands that act like biological glue. It completely tethers these tissues together, ruining that normal, healthy glide, which in turn severely limits your range of motion and triggers all that pain.
Let's break down the biology of how an adhesion actually forms. It usually starts as a well-intentioned but ultimately flawed attempt by your body to heal itself. Step 1. You experience some kind of incomplete healing or tissue overload, like micro tears or inflammation. Step 2. In a total rush to patch things up, your body lays down extra collagen. But instead of laying it down in a neat, organized way, it patches it up in a totally chaotic, disorganized pattern. It's essentially creating scar tissue. And finally, step 3. This disorganized collagen creates dense bands that physically tether your tissues together. Basically, your body tried to heal you, but it accidentally glued everything shut.
So what actually triggers these sticky bands? It's not just major car accidents or extreme sports traumas, though acute injuries like strains and sprains absolutely cause them. It's actually often just simple, repetitive motions. Think typing at a desk all day or your daily running routine. Those can cause constant microtrauma. But even more fascinating, prolonged inactivity, like recovering from a surgery or simply sitting way too much, can absolutely be the culprit. Add in poor posture that keeps your muscles in shortened positions, and dehydration, which literally dries out your tissues and stops that healthy fascial glide, and you have the perfect recipe for muscle adhesions.
Okay, so how do you know for sure if your pain is an actual adhesion? Well, clinicians use a specific physical checklist. You'll definitely feel highly localized tightness or tenderness. A really major giveaway is a catching sensation when you try to move a certain way, or a noticeable drop in the range of motion in a specific joint. If you press down on it, you might even feel a firm, tethered knot under the skin. But honestly, the most insidious symptom is compensatory movement patterns. Your body's smart, right? So if your shoulder has an adhesion, it will subconsciously make you shrug your neck just to avoid the pain of moving that shoulder properly.
And that brings us to a massive critical concept, the kinetic chain reaction. Let's zoom out and look at the whole picture. Your fascia doesn't just wrap individual muscles, it connects your entire body. Muscles, nerves, even organs, in one huge continuous web. Because everything is connected, an adhesion is literally never just a local problem. A restriction in one single area will inevitably ripple through the rest of your body, completely sabotaging your overall biomechanics. Let's look at a super practical example of this kinetic chain in action. Say your origin point is a tight calf muscle caused by an adhesion. You might just think, oh, whatever, my calf aches. But that tightness actually alters the exact way your foot hits the ground, which completely changes your walking gait. And the ultimate impact? You start putting undue, repetitive stress on your knee or your hip. Patients go into clinics all the time complaining of hip pain, only to discover the root cause is actually a sticky adhesion all the way down in their calf.
Right, now we get to bust some major myths, and this is where a huge paradigm shift needs to happen. Myth number 1, stretching alone will fix it. We've all tried this. The reality, it absolutely won't. Look, while stretching is great for general health,
Adhesions require mechanical disruption. Think about it this way. If you have a really tight knot in a shoelace and you just pull hard on both ends, the knot just gets tighter, right? You have to actually get in there and mechanically disrupt the tangle with your fingers. For adhesions, this means targeted manual therapy combined with graded movement and loading. Okay, on to our second major myth. It's just a temporary muscle spasm or a simple cramp. If you treat an adhesion like a cramp, you are going to fail to heal it, for sure. The reality is that adhesions are stubborn structural tetherings. They involve the physical, disorganized alignment of collagen across your fascia. This is an actual, physical, structural roadblock built out of bodily glue. It is not just a fleeting electrical spasm in the muscle.
And finally, we have the classic myth. Just rest on the couch until it goes away. The reality is honestly quite the opposite. Prolonged rest will actually worsen the stiffness because your tissues become way less pliable and the fascia glides even less. To break up that disorganized collagen, you need graded, progressive movement. Active movement promotes healthy tissue remodeling and essentially teaches your body how to lay down new collagen in the correct, organized directions.
So how do we actually break up this sticky tissue? Let's map out some clinical solutions. Evidence-informed treatments start with manual therapy. This includes things like myofascial release, trigger point therapy, and cross-friction to physically disrupt the adhesion. Chiropractic adjustments are also super common here to improve the underlying joint mechanics that are influencing that muscle tension. Then, active rehab is absolutely crucial. Eccentric strengthening, mobility drills, and even nerve glides. And don't underestimate the basics. Heat and systemic hydration are vital for increasing your tissue's pliability before the physical work even begins. If you go to a clinic for adhesion release therapy, here is exactly what you should expect, step by step. Step 1 is the warm-up, utilizing heat or gentle movement to get the area prepped and ready. Step 2 is the core of the treatment, the mechanical disruption. The therapist will use sustained pressure, cross-friction, or even instrument-assisted strokes right along the direction of the muscle fibers. And yeah, you might feel some mild discomfort here. That is totally normal, as the sticky tissue is mobilized, but it shouldn't be unbearably painful. Finally, step 3 is progressive loading through strength work to ensure the tissue heals correctly. Now, recovery doesn't happen overnight, but it is highly predictable if you follow the right timeline. In the first 24 hours after treatment, your aftercare is absolutely critical. Avoid heavy, stressful loading, do some light movement, and stay really hydrated to help the tissues remodel. Over the first week, patients typically attend 1 or 2 manual therapy sessions while strictly adhering to a home program of mobility drills. And by weeks 2 through 4, if you're consistent, you're going to begin to significantly regain your range of motion and notice that super annoying catching sensation just fading away.
So, the crucial point here is captured beautifully in this simple clinical mantra. Mobilize, then strengthen. It's incredibly simple but profoundly effective. You literally cannot just build strength on top of glued down, restricted tissues. It doesn't work. You must first mobilize the area, mechanically disrupt the adhesions, and restore that normal glide. Once the tissue can move freely, then you strengthen it to lock in those healthy movement patterns and prevent the adhesion from ever coming back.
Which leaves us with a final, fundamental question to evaluate your own physical habits. When you are dealing with chronic tightness or that persistent tightrope knot, you've got to ask yourself, are you just stretching, blindly pulling on tethered tissues and just hoping for the best? Or are you taking the steps to actively remodel your tissues through targeted mobilization and progressive loading? Next time your body feels stuck, remember the biology, ditch the endless stretching, and focus on breaking the glue.